Well, Steve, we're back, but a whole lot of the businesses who shut down in the spring uh, find themselves now with their doors closed again. And once again, we're embroiled as a state and it's back and forth over what the right policy is to contain this pandemic. And the governor's shutdowns, not quite as broad as they were in the spring, but I think there's a lot of anxiety that they may be headed toward there and for much longer than the 3 weeks she proposed.
Well, I think she's made it clear that from the beginning that she is going to be guided by the numbers. The public health numbers have just been getting worse and worse and worse. The number of infections that are reported each day continue to rise. The number of hospitalizations, the death rate is not going up as fast as it did in the spring because there are better treatments for COVID than there used to be. But that's also coming back. There are people who are losing their lives in large numbers to this disease. Again, what happens when you put something above public health? The Flint water crisis is on my mind a lot right now as we're having this debate about what you're supposed to do when there's a public health threat. Republicans can't seem to get this right, which is frustrating. But it's also confounding because, it's a party that touts itself as preserving life, as pro-life, as they would call themselves in many instances. But when it comes to the question of elevating life concerns, public health concerns over money, they get it wrong. And
Well, it's not about, we've had this discussion before, Steve, and it's not about money now, and it wasn't about money then. It's about the best approaches to handle this. And Governor keeps saying science, 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 but where she's dealing now more with assumptions than she is with science. I think people of both parties are concerned about the spiking numbers. You saw numbers ebb in the spring when the weather started warming, people started going outside more. And just like it happens every year with the full flu season, now that we're back inside, you're seeing the numbers spike up. But what she's done here is shut down all these restaurants who in good faith put in all these safety precautions in place to reopen their business. Most of them had been following carefully the protocols and the guidelines, and yet she shut down these folks. Many of them aren't going to survive. So it's not as you cast it, the people who don't want to shut down don't care about life. They don't know, aren't convinced, and rightfully so, that this is the right approach. I think what we're seeing right now is this virus being spread among families, among small groups of friends. And that's where our focus should be, in convincing people you can get this virus from a family member. You can get this virus from the person next door. You can't let down your precautions, your protocols, your staying safe just because you know the person. And I'm not sure shutting down the economy is going to help that.
Yeah, but the idea that somehow you should stay away from people in your family or isolate in that way, but you'd be fine to go out and congregate in a restaurant defies the most basic common sense about this disease. And there is no health professional who's saying, hey, let's keep people away from people in their homes and let them congregate in public spaces. No state.
Note when this surge began, 5, 6, 7, 8 days after Halloween. You're going to see the same thing after Thanksgiving and after Christmas. Those aren't restaurant gatherings. Those are home gatherings, neighborhood gatherings. And the focus should be on how we attack that, because that's going to be in place all winter.
You think where you gather is the issue as opposed to the idea of gathering? I mean, people do need to stay away from other people outside their bubble or their pod or whatever they're calling it, but they got to do it universally. It's not about where you are. It's the proximity to other people. Here's what the real question is. Why can't we come up with a way to help support businesses through what is, everyone agrees, is a temporary period of crisis? As a nation, we've been really awful so far at figuring out how to incentivize people to do the right thing in a public health context, because they could know that there's support for their businesses and for the other economic activity. And this is another
Well,
problem that we
I
have.
agree, Steve. I agree. But these orders didn't come with that sort of help. They didn't come with extra
Why is that?
unemployment. They didn't come with
Where would
extra
that come from?
assistance for business. There's no money for the state to provide the help people are going to need to get them through this government ordered shutdown and the impact that's going to have on their livelihoods and their businesses. Uh, just no resources.
There isn't at the state level. And again, you've got to look to the federal government to get its act together, which probably won't happen at least until after January 20th. And even then, you've got to have a different approach in the Republican Senate than they've had in the past to Democratic presidents.
And hopefully you'll have a different House Speaker. Maybe we'll finally get past Nancy Pelosi and her insistence that a COVID relief bill include every single item on a broad Democratic wish list. The help should be targeted, and it should go to the specific people who are suffering. And that last round didn't do that.
I mean, my approach would be that the broader the better, not the narrower the better, because if people get what they don't need, that's not as damaging as people who need something and not getting it. And I think the way to do it is broader. But I agree with your general point there that we haven't done well with this, and we got to do better.